For more than 2 decades, he's provided personalized care and comprehensive health services to women. He is board certified by the American Board of Obstetrics and Gynecology and is a fellow of the American College of Obstetrician and Gynecologists. He's cared for thousands of women all over the world suffering from symptoms of uterine fibroids with dedication, compassion, and attention to detail. Please welcome Dr. Michael Randell. Dr. Randell, thank you so much for joining me today on The Couch.
Thank you for having me.
So you are a leader in robotic fibroid removal. For the audience, can you tell us why using robotics to remove fibroids is on the rise?
Well, robotics is a minimally invasive approach to removing fibroids. Fibroids, we also call it a myomectomy. We take the fibroids out of the uterus so a woman can keep her uterus for future childbearing. When using robotics, it's a minimally invasive approach. Through just a tiny incision in the patient's abdomen, we can put instruments through these trocars connected to a robot, and it's like playing a video game in the corner of the operating room where we can control the instrument, the arms, to take out the individual fibroids and then to suture the uterus back up in a multi-layer closure. It's very important when performing this type of surgery is that it's done just like you would in an open operation, but we do it minimally invasively, and the advantage of the patient is that it's an outpatient procedure and she has minimal pain and she can go back to work within a week or two.
That's fantastic. So can you tell me about the different types of surgeries that you provide to share with our audience?
So when we're talking about surgery for fibroids, we all know hysterectomy. Hysterectomy is taking out the uterus. Many women don't want to lose their uterus. So the option is doing a myomectomy. The myomectomy is a removal of the individual fibroids. It depends on where the fibroids are located, it depends on the size of the fibroids, it depends on the number of fibroids. So if somebody has 60, 70, 100 fibroids, there's not enough hours in the day to do it minimally invasively. So that patient's going to have an open myomectomy. So it'll be like a C-section incision. Okay. We lift up the uterus, we cut out those individual fibroids. But if a patient has, say, a dozen, maybe even 20, and they're confined to the uterus, and they're in areas that we can access very easily, that could be done minimally invasively, laparoscopically, or robotically. And then there are the fibroids that are inside the cavity of the uterus. So if you think about what the uterus is, it has the muscular wall, and inside you have the endometrial cavity. That's where the baby is. We can go through the vagina, through the cervix, with a device called MyoSure, and we can actually remove the fibroids from inside the cavity through a very minimally invasive approach. This is actually the device that we use, that we can go through with a video camera, we can see the fibroid, we can go in here, and we can actually remove the fibroid if it's just within the endometrial cavity. Wow. That's the ultimate minimally invasive surgery.
Are there other types of surgeries that you can share with us?
Well, we talk about laparoscopic, we talk about robotic, we talk about open procedures. That's the classic incision that a lot of people don't want these days, and the hysteroscopic approach.
Are there some benefits to the laparoscopic?
Certainly. The benefits to the patient is they end up with tiny incisions. The way I do my surgery, it's just 3 incisions, 1 in the belly button and then 2 either side. And these are the actual size of the trocars that we use. So you can see they're about 8 millimeters, less than a centimeter. Very, very small. Patients recover much quickly. They have less pain. They can go back to their routine sooner than if they have an open surgery. With an open surgery, typically you're out of work maybe 6 weeks. You can't drive during that time. You're taking more pain medications. Definitely a lot of advantage to having minimally invasive surgery, robotic surgery.
Can you talk about fertility and women that still may want to have children and the options that we need to be aware of?
Sure. Well, a lot of women come to me because they've had problems with either getting pregnant or they've lost their pregnancy and they have fibroids. And we say that all women with fibroids don't need their fibroids removed. But if the fibroids are affecting a pregnancy or making it difficult to achieve pregnancy, then it's time to get that assessed and have your fibroids removed. I have a patient where I took out an 18-pound fibroid from her in an open operation, and a year later, or 2 years later, she was pregnant and delivered a healthy baby.
That's a major success story.
Major success. It's
wow.
Very rewarding what we do, being able to have the patient keep her uterus. Because women wouldn't fear that. When
right.
they go to their gynecologist and they complain about their symptoms, they're diagnosed with fibroids, so many providers, so many physicians say you need a hysterectomy. And if you lose your uterus, no opportunity, except if you still have your ovaries, you can do in vitro fertilization, use a surrogate. But if you want to deliver your own baby, having a myomectomy is the way to do it.
So tell me, is there a story or a case where what's the worst case of fibroids that you've seen, and maybe can you share a little insight about that?
This was a patient who came in that looked like she was 15 months pregnant.
Oh my gosh.
So you can imagine what 9 months looks like.
Right.
She was just massive, and she did not want to have a hysterectomy. She wanted a myomectomy. We opened her up, we took out 150 fibroids from her. And her symptoms went away. First of all, she no longer looked pregnant. She no longer had the heavy period. She no longer had the pain, the pressure, always having to go to the restroom. So it really is life-changing to be able to do surgery like this for our patients.
And you talked about, removing that fibroid. Have you removed one individually that has weighed a certain amount? Can you talk about that a little bit?
My record is the patient who had an 18-pound fibroid. It was absolutely massive. One fibroid, and we were able to take it out separate from the uterus. She kept her uterus, and she went on to conceive and had a healthy baby.
So how long have you been doing this type of work, Dr. Randall?
So I've been in practice for about 23 years. I've been doing robotic surgery, minimally invasive surgery for about 11 years now. In 2007, I started doing robotic surgery and really found the benefits, especially for myomectomy. So I'm known as the fibroid king, and I take out some of the most challenging fibroids that I see. People come in from around the country and around the world for this surgery. And
you've talked about how personally rewarding it is for you. Can you share a little bit more about why you find it so rewarding, besides the obvious?
So in 23 years, I also delivered babies.
Okay.
That's very rewarding. Stopped that 2 years ago, and now I'm just focused on minimally invasive surgery, primarily fibroids. And again, I see patients coming in from around the country. They've been to other doctors, and doctors said your only option is to do a hysterectomy. And I look at their films, and I say, I can do this. I can do it minimally invasively. I can remove your fibroids. I can do this through an outpatient procedure. And patients start crying in the office. And then you do the operation, and they just look at their belly and they see these 3 tiny incisions, and they're just amazed, and they're so thankful. And you get nice thank you cards from patients and nice comments online, and then it's very rewarding.
Yeah, and it enhances the quality of life.
Absolutely.
For the patient.
It's life-changing for patients because, again, women are fearful of that word hysterectomy. They don't want to lose their uterus. There's options for patients, and we talked about it. You can do an open myomectomy, take out the fibroids. You can do a minimally invasive laparoscopic robotic myomectomy. And if patients are lucky enough to have a fibroid just within the inside of the uterus called the endometrial cavity, we don't even have to go in your abdomen. We can go through the vagina, through the cervix, and just take out the fibroid that's inside the cavity of the uterus. What we know is that surgeons that do a lot of cases have better outcomes. So it's important to know how many cases your doctor has performed. In my specialty of OBGYN, many times a woman has delivered a few babies with her obstetrician, who now becomes her gynecologist, and they're so loyal to that physician, so whatever the physician says, the patient goes with, even though it may not be the right decision. So if you feel you're not getting what you want from your doctor, there's no reason to not get a second opinion, or a third opinion, or a fourth opinion. I've seen it within my own practice, and patients say they've been to 10 doctors. They all say they need a hysterectomy, that she needs a hysterectomy. And I look at their films and I say, we can do this, and we can do this laparoscopically, take out these fibroids. So it's very important to find the right doctor.
The right doctor for the right patient.
Absolutely.
Now tell me, how many surgeries do you perhaps do a week to remove fibroids?
Depends on the week. A good week, it will be 6 to 8 surgeries.
And on average, are there multiple fibroids typically within the uterus and things of that nature?
So when you put yourself out there and you're identified as an expert, you get the most challenging cases. So the most challenging cases to me are the patients who have innumerable fibroids. That's when the radiologist looks at the MRI and says, too many to count. So if there's too many to count, we know it's going to be a tough surgery. Those are going to be done open. So I have a lot of patients that come in with the multiple fibroids. And then we have the patients that come in with the huge fibroids. 2 weeks ago, I did a fibroid that was 30 centimeters. I was able to take it out through 3 tiny incisions. That's a 5-hour operation, but the patient is the one who benefits in the end because we were able to do it through tiny incisions, and she went back to work within a week.
That's fantastic. Dr. Randall, it has been a pleasure to have you sitting on the couch with me today. What are some ways that we can educate ourselves or even get in contact with you?
Well, you can go to my website. I have two websites. One is www.fibroidsatlanta.com. The other website is obgynatlanta.com.
Thank you so
And I can be reached either website.
Thank you so much for joining us on In Contact.
Thank you, Robin.
Thank you.